and they're not happy where they are, they don't like the way it feels, they don't like the way it looks, they can come and we can fix it. But they have to understand, I want people not to have to do that. But if they do, we can help them.
I use, I talk to doctors, and I use this analogy where I said, if you had a loved one in New Jersey, you're from in New Jersey, if you had a grandma type that you grew up with, that they're in Honolulu, and they say, I'm not flying back out. I have a lower denture. I should have listened to you, but I need to find a dentist that does implant dentistry in Honolulu. I know what you wouldn't say. Oh, just call around, find out who's the cheapest. Like, you would be, correct me if I'm wrong, probably concerned or obsessed with their workflow,
Yeah.
their experience. Do they have the technology? Are they doing it all under one roof? And could I see some of their work? The price you wouldn't even worry about, right?
Right.
I mean, that would be so secondary. The people in the know. Is that true?
Yeah, I mean, I wouldn't even think about the price. One of the things that I'm very gifted in the fact that I was able to teach a lot of doctors all over the world. So I have a network of doctors that are doing my flow, that are doing my standard, that are doing dentistry the way I want. So I would say to them, I have a dentist that came to my class.
You know what I'm picking up on too, because look, I know a lot about you, met you a long time ago, and you have a style about you. But one of the things that I learned more and more, the guys that are the great ones, they actually care. Like, they care about the patient.
Yeah.
And I forgot that about you, right? Like, I only see you on social media and we talk from time to time and this and that. But it seems like you cared.
Yeah.
Do you think that's important? That you got to really be
so important.
Patient obsessed in a way?
Yeah, I care so much about my patients that sometimes my wife says to me, wow, I have never seen a doctor like this. This is unbelievable. And, I'm super passionate about what I do. And I want my patients to have the best result for them. And I want them to take care of their teeth. And I want them to walk around and say, I love the way I look. I love the way I feel. And that's because I made the right choice. I don't want them to have that regret.
And so sometimes you have to have tough conversations
Yes.
with patients because you care.
And that's okay.
I mean, look, I'm in the advertising and marketing business. Doctor want to come in here and say, Randy, there's a problem going on. There's probably close to 1 million complications, things being done wrong that we're going to have to repair, and let's take it to your show. And as a marketing guy, because I care, I'm going, do we really want to send the message out there that things go wrong, that they get loose, they fall out, they get infected? Do I really want to talk about the botched stuff on the show, and I have to argue with you and try to talk you off the ledge to talking about it because I care, right? Because after doing marketing, look, I said this on the phone to you. If I'm the #1 producer of infomercials in the world, I'm also the #1 producer of failed infomercials in the world. And there's subtle nuances to marketing and advertising. That's why that it also, I have that same chip where, you're hiring a person to do your website, you're hiring a person to do your Google ads, you're hiring a person to do your marketing, and they better know at least what I know about dental implants. They need to be well versed in it. And what marketing books are they reading? And what ongoing education are they doing? But I think that this message, and we're talking about the struggle is, how do we tell the truth without scaring the rest of the population off? I told you, we did a breast augmentation show with a guy, Dr. Berman. He came up with a way to eliminate capsular contraction, hardening of the breast. And it was a sleeve that went over implants, because like 10% of all women that get breast augs, they get hard as a rock or lumpy. Well, this is something not talked about, right? It's private. But he came up with a solution.